So tell us about yourself.
Okay, so I've spent the past 4 years in healthcare. My current job right now is at Pediatric Urgent Care Fort Worth, and before that, I was a nursing assistant both at a family clinic and also at Texas A&M Student Health Services. Despite all of this, it was really my first trip to Tanzania where I fell in love with caring for others. It was at that time in a non-healthcare capacity that I served others from all different kinds of backgrounds and learned about their culture and their triumphs and their hardships. And I was really able to connect with them in that way. And so that's really where my love for caring for people kind of stemmed from. I want to go into pediatrics mainly because I believe that it's equally challenging and also rewarding. And I know that pediatrics involves a great deal of patient education, and that is my absolute favorite part of nursing. And although I really appreciated all of the direct patient experience and skills practice that I've had by working at the past 3 jobs in healthcare, I look forward to advancing my career into nursing and partnering with a hospital that holds up the values that I appreciate as well, such as evidence-based practice, caring for the patient, and looking out for the patient's best interest, as well as collaboration.
So where do you see yourself in a career in 5 or 10 years?
So I see myself either having or in the process of getting my master's degree as a clinical nurse specialist. I am a very driven person to be the best that I can in whatever that I do. So I've trained several new patient care technicians at Pediatric Urgent Care who've had absolutely no healthcare experience. And I've really enjoyed the mentorship in that process. And as a clinical nurse specialist, having that mentorship ability as well as being at the bedside and incorporating and researching new evidence-based practice to be implemented into units, I think that combines all of the above beautifully.
Okay, well, what previous job was the most satisfying and why?
So I'm a big people person. I really enjoy interacting with people from all backgrounds and cultures, and I see needs, and I love working alongside a team to make sure that those needs are met in the most safe and efficient way while keeping the patient's best interests in mind. In the past, whenever I've worked with adults, I've noticed that they're able to cope with being at the doctor's office fairly well, but it's a different story with pediatrics. So kids, they're being thrown into an unfamiliar environment and they're out of their routine, and I can see how it'd be distressing because they're also not feeling well on top of all of that. And so it's through my job at Pediatric Urgent Care that I've learned to really ease their discomfort. And if I can coax a smile out of just 1 or 2 patients who are having a particularly difficult time, then I'd say that that's a good day. And also it could be holding a parent's hand as their child is being whisked away by the ambulance and just letting them know that it's going to be okay. So that's something that I really gained, and I think it's very valuable by working at Pediatric Urgent Care in the sense of caring for little ones.
Okay. Tell me about the most difficult patient or customer service experience that you have ever had to handle. Perhaps an angry or upset patient or a customer. Be specific and tell me what you did and what the outcome was.
So last winter, Pediatric Urgent Care got hit really hard with the flu, and it's starting to pick back up this year. And it was during this time that wait times were about an hour and a half to an hour and 45 minutes, which is longer than the wait times usually are, and the parents are more accustomed to. And so we had this one particular very, distraught and irate mom who was just sitting in the waiting room and just, you could tell that she was building up to a potential outburst. So she started to kind of have this outburst, and she was yelling in the lobby, and other patients were getting upset because it was, very disturbing. And so what I ended up doing was I pulled her into this little back area where we could have more privacy, and I talked to her about the fact that there were still 3 patients ahead of her, and we were trying our very hardest to make sure that they got into the room as soon as they could. And I offered her, water, because they had been there for quite some time already. So I offered water or juice, and I also brought in one of our nurse practitioners so she could also assure her that she was working her fastest to get to this customer or to this client. And after just taking a little time to, pay attention to this mom's needs and her concerns and everything, it seemed like she calmed down a little bit, and she was able to go back in the waiting room and wait her turn, which was not very much longer, but just taking some time to make sure that this mom felt like she was heard. I think that was the most important thing that I learned out of this situation.
Okay. Tell us about a situation in which you had to speak up or be assertive in order to advocate for a patient or an idea in order to get an important point across.
Okay, so this was last semester in the fall. I was at the medical ICU, and I was helping out a nurse who was not my preceptor for the day, and because her patient was pressing the call bell. And so I went in, and it turned out the patient needed a complete bed change and linen change. And so while I was in the process of caring for that patient, I was turning the patient to the side and just helping to get everything cleaned up. And I noticed that the patient had a stage 1 pressure ulcer on the backside. And so it was something that was it was new for this patient, I should say. And so I ended up going out, and I let the nurse know. That way they could apply some Meplex to it and get it covered up and charted and documented. And so they could also put the patient on more of a strict turning schedule. I think what happened was this patient was less critical than the other patient that the nurse had. And so the turning was not a priority for this nurse because of the other needs of the other patient. And so I just wanted to make sure that this patient was cared for just as well as the others. And so I think advocacy is a huge part of my practice, even as a student nurse. And so that's something I definitely will continue on in my nursing career as well.
All right. Thank you very much.
Thank you.